It's not ADD, by the way. That one's different. That's the one you diagnose yourself. That's where people are like, oh, sorry, I tuned out of your story. I have ADD. No, you suck. You're addicted to your phone. You need to take responsibility.
Last week, we began our deep dive into the world of ADHD. What it is, why diagnosis rates are rising, and how this very relatable disorder has been adopted by some to explain general inattention. I introduced common types of medication used to treat the disorder, and we began to focus on the stimulant class of medication. Potent, fast-acting, and as a result, very common. You'll recall that there are two categories of stimulants: amphetamine, mainly Adderall, Vyvanse, and methylphenidate, mainly Ritalin and Concerta, which are both offered in short and long-term release options that work similarly on our brain and our body. Generally speaking, these drugs are powerful, and as we know, any powerful boost is followed by a crash of some sort.
And I understand what people mean about the short duration. It's already starting to come down.
And with these drugs in the hands of many people, both with and without ADHD, a deeper understanding of how they work will help us to understand why it's important to handle them with care. Once we've got a little more knowledge under our belts, we'll consider the complex relationship between ADHD, its drugs and treatments, and modern society. Interns, I hope you've got your learning hats on. We've got a lot to cover, and I won't hold back. Ever heard the word sympathomimetics? Sympathomimetic is the category of drugs that stimulant ADHD medication falls into, so named because they
trigger the release of neurochemicals and the activation of components of our nervous system that very much resemble the activation of the so-called sympathetic nervous system,
mimicking the effects of the sympathetic nervous system, hence the name. Get it? The sympathetic nervous system refers to the arm of the autonomic nervous system that handles alertness and arousal. Fight or flight.
This results in your body moving blood and energy towards the major organs and away from your limbs and digestion.
Generally, these drugs work by increasing availability of dopamine, known as the feel-good hormone, and norepinephrine, similar in effect to adrenaline, in the brain,
which essentially increases alertness.
And as fellow YouTuber Dr. Huberman explains, when these chemicals are released around the brain,
they increase motivation, focus, and alertness, and they tend to do that at very focal locations in the brain.
Imagine a little gardener, ADHD medication, watering important locations around the brain with a special formula, dopamine and norepinephrine, that increases motivation and attention towards the task at hand. To be more precise, these medications directly enhance neurotransmitter activity by either increasing release or inhibiting reuptake of the aforementioned chemicals, allowing them to accumulate beyond normal levels within the synaptic space, which in turn enhances signaling between neurons. Let me explain. The synapse is the communication point between neurons, across which chemical reactions occur in order to transmit information from one neuron to the next. Biological telephone, if you will. Think of each neuron as a small self-contained structure equipped with the necessary structures to transmit info to the neighboring neuron. One such structure is the axon, a slender projection that reaches away from the neuron and through which our neurotransmitters, dopamine and norepinephrine, are actually projected across the synapse.
So for instance, there are proteins down at the end of the axon that package neurotransmitter into little spherical things that we call vesicles.
Are you following? Long arm of the neuron holding a package of neurotransmitters.
Those vesicles can fuse with the end of the axon and vomit the contents, those neurotransmitters, into the synaptic cleft, into that little space.
And with norepinephrine and dopamine available in the synapse, there's a greater likelihood that they will bind to receptors on the postsynaptic neuron. That is to say, the one receiving the information on the other side of the synapse and opposite the presynaptic neuron, leading to enhanced signaling between said neurons. Typically, once the message is sent,
and then the signal will propagate from one neuron to the next.
Specialized transporter proteins remove the remaining neurotransmitters from the synaptic space to terminate the signal and allow for the system to reset for the next signal transmission. These proteins very literally
suck up or suck back up some of the neurotransmitter that's been released.
Except ADHD medication does not catalyze normal function.
In a typical neuron, dopamine and norepinephrine is released into the synapse from the presynaptic terminal.
Remember when I said it inhibits reuptake of neurotransmitters? Well, this is how. By disrupting the activity of these presynaptic transporters.
So, more dopamine and more norepinephrine remain in the synapse for a longer time.
And these medications don't even stop there. They even disrupt the proteins at the end of the axons that package neurotransmitters into vesicles. Remember those? Yet another interaction that contributes to the accumulation of neurotransmitter in the synaptic space.
More of it is allowed to stick around and to bind to receptors on the postsynaptic cell.
Overall, more dopamine and norepinephrine is released, and once released, it has no way back. You can understand why these drugs create such a potent effect. Now, dopamine and norepinephrine are also neuromodulators.
That is, they have the ability to increase or decrease the firing patterns, the electrical activity of particular brain circuits.
That is correct. Both dopamine and norepinephrine have dual roles as neuromodulators. That is to say, regulators that influence overall nerve cell activity, and neurotransmitters. That is to say, messengers that carry signals between cells, highlighting their importance in both specific signaling pathways and the overall modulation of brain functions. In terms of modulation, dopamine affects the brain in the prefrontal cortex by, you guessed it, serving as a noise reducer.
Help further enhance the quieting of all that background stuff, as well as your representation of your internal bodily state.
This affects both our interoception, the perception of internal bodily sensations, thoughts, hunger, etc., and enteroception, or the perception of external stimuli from the environment. For those of you with experience with any of these medications, you'll know where we're headed. When you get right down to it, what does the act of focusing involve?
It involves often forcing ourselves to sit still, often involves us suppressing the fact that our foot is a little bit cramped.
So dopamine also helps suppress the signals that would otherwise distract us. You might forget to eat or skip out on a bathroom break for hours on end, allowing you to zero in on the task at hand.
Which include things like thoughts, but also includes, for instance, how empty or full our gut feels.
Norepinephrine affects the brain in a complementary way. It is released at many sites, but its central hub is the locus ceruleus, a small collection of neurons at the back of the brain.
It's actually a relatively small collection of neurons, but they are very, very powerful. They extend their little axons to multiple locations in the brain.
It is sprinkled throughout the brain and boosts signals at the synapses
to increase the amplitude and frequency of communication between neurons.
So with dopamine and norepinephrine, we get a two-prong effect. A reduction in noise in the circuitry that we don't want to hear from, as well as an increase in signal of networks that we do want to pay attention to.
And the net effect of that noise reduction and signal amplification is what the engineers refer to as increased signal to noise.
This results in a heightened subjective sense of focus. We can decide what we want to focus on and then focus on it, no questions asked. As you might imagine, for those of us who experience difficulty focusing our attention, this is akin to a new superpower. That being said, too much dopamine and norepinephrine can cause euphoria, mania, psychosis, agitation, panic, etc. These drugs are meant to fine-tune the concentration of dopamine and norepinephrine present in particular brain networks,
in order to allow the person to arrive at just the right balance between the activation of these different neural circuits.
It's just like baking a cake. If the cake were an effective dose of focus for any individual trying to function effectively day to day, that is. A little less background noise, a little more signal. Non-stimulants work slightly differently. These medications, such as atomoxetine and guanfacine, regulate norepinephrine levels, typically by blocking reuptake or by stimulating what's known as the alpha-2 adrenergic receptors, rather than by increasing the dopamine and norepinephrine levels altogether. Take guanfacine, for example. As Dr. Russell Barkley, American neuropsychologist and retired professor, explains,
it goes to the frontal lobe and it fine-tunes the signal in nerve cells.
Thanks, Dr. Barkley. And if you don't mind, how does it do this?
By latching onto a nerve fiber and opening or closing the little ports along the nerve cell, the alpha-2 ports.
So, alpha-2 receptors are specific ports located along nerve fibers that respond to the neurotransmitter norepinephrine. When norepinephrine binds to these receptors, it inhibits the release of additional neurotransmitters from the neuron, effectively reducing the transmission of signals along the nerve fiber. This mechanism serves as a way to regulate and modulate neural activity in the nervous system. Thus, when you open the port, the signals get dampened by the inhibitory effect of incoming norepinephrine and noise comes into the signal. Alternatively, when the port is closed, the signal is stronger down the nerve fiber. Signals that are stronger and less confused by noise are more likely to reach their target and have the desired effect. With this in mind, non-stimulant ADHD medication is essentially activating the executive system, so signals are cleaner, stronger, and purer. Both stimulants and non-stimulants affect the executive systems. They just go about it differently. Which drug the doctor prescribes depends on the patient's needs and tolerances. So far, we've covered how the drugs affect attention, but ADHD meds also serve as emotional regulators. 70% of brain areas activated by these stimulant and non-stimulant drugs are shared, while 30% are not shared. That is to say, uniquely activated by the different classes of drugs. These uniquely activated regions tend to be in the emotional regulation centers, which means these medications regulate emotions differently. On the one hand, stimulants work to control emotion through suppressing the limbic system.
The higher the dose you give, the less activity in that system.
They basically get rid of emotional reactions by getting rid of emotion altogether.
I can control your affect by eliminating your affect. One way to control emotion is to prevent it from occurring to begin with.
However, the complete suppression of this system can cause emotional blunting. According to Dr. Barkley, 1/5 of patients complain about this.
They begin to lose their affect. Yes, they're compliant. Yes, they're productive. Yes, they're obedient. But that's all they are.
It's pretty shocking when he describes it like this.
The patient becomes like almost an automaton. I don't need a bland robot that sits at a computer.
Non-stimulants don't do this. They have no effect on the limbic system. Rather, they activate the anterior cingulate and frontal lobe, the executive of emotion. Dr. Barkley claims that meds like atomoxetine would be better at managing general symptoms of ADHD without downregulating effect to such an extent.
Because it's doing it at the site where the problem is, at the site of the executive system.
So, while stimulants are good at improving attention and the executive system tasks, that is to say, cold cognition, working memory, they are not so great at emotional regulation. Doctors thus consider prescribing combinations of these drugs at lower doses to mitigate side effects. Other side effects that are common in stimulants are decreased appetite and weight loss, headaches and nausea, also anxiety and tics, though 10% of kids with ADHD have tics anyways. They can also affect your mood, particularly when it's wearing off. The rebound effect, or come down, can make people irritable or emotional, though it's important to note that you may just be hungry from missing a midday meal. That is to say, angry.
But I'm hungry.
I know.
I'm hungry.
Also, if the dosage is too high, the person may be zombie-like or sedated. These are very strong medications. This was a primary reason my own mother took me off these medications when I was a child.
Yeah, they helped me to think.
And we're not finished.
Adderall can cause sleep disruption and serious cardiovascular side effects such as high blood pressure and stroke.
Large doses can also induce seizures and cardiac events. Long-term use is mildly associated with cardiovascular health problems, so it's best to avoid anything that would exacerbate that further.
Avoiding smoking or vaping nicotine. Regular exercise is going to be encouraged.
Due to abnormally high levels of dopamine associated with large doses of sympathomimetics, psychosis is also a risk factor.
which presents with individuals being disorganized, maybe seeing things that aren't there, hearing things that aren't there, or bizarre behavior.
Especially for those who have a relative with schizophrenia or bipolar, which predisposes you to psychosis. With these risk factors in mind, it's best to aim for minimal effective dosage and then increase from there only if needed. Habituation occurs when the drug is taken over long periods of time.
Which is not to say that the person becomes entirely desensitized to the effects of the drug, but rather that the system equilibrates.
Ever heard the term homeostatic plasticity? In neuroscience, homeostatic plasticity refers to the capacity of neurons to regulate their own excitability relative to network activity. So when dopamine and norepinephrine are elevated above baseline for a while, the system normalizes to their elevated presence, adjusting to their effects to maintain balance and stability. In this case,
the connections between neurons become stronger, and there isn't the critical requirement for all that increase in dopamine and norepinephrine.
The result is that the response to the drug over time isn't as intense, and the spike in dopamine and norepinephrine is lessened.
You need to keep taking more and more Adderall to get the same effect.
Rightfully so. People are concerned about becoming dependent to such powerful drugs, especially in kids' lives, as well as the risk of developing tolerance in general. A physiological dependency on a chemical substance means that if you stop taking it, you may experience withdrawal symptoms, which we've explained before on other videos.
That's not necessarily a bad thing, it's just something that you need to be aware of, almost from a safety standpoint.
Lest someone who has become dependent on their medication attempt to stop cold turkey without preparing for the consequences. I won't be the only one to suggest gradual changes in dosage, whether you're talking about taking more or less of these drugs.
But I have tried to wean off of it because I don't want it not to work when I need it.
Right. So you want it to be a tool.
In fact, as Dr. Huberman mentions here,
many of these drugs were designed to be taken during the school week for children with weekends off, during the school year with vacations during the summer holidays.
Drug holidays, if you will, to avoid developing tolerance. This concept was supported for adults as well, though it isn't as common anymore. The evolution of research has led people to believe that such drug holidays allow symptoms to creep back, leading to inconsistent behavior.
And I need to pay attention every day. I don't want to be like missing some days and be like okay other days.
As Dr. Alok Kanoja, or Healthy Gamer Doc, explains, you can't afford to treat 80% of the ADHD and leave 20% untreated. So yeah, the idea is consistent med taking equals consistent behavior. But that leaves many with ADHD concerned that they are going to be dependent on these meds forever. But as with anything, it depends. Ideally, the medication helps to create the conditions necessary for your brain to undergo neuroplasticity, the ability of the brain and nervous system to form and reorganize synaptic connections in response to learning. So yes, there is an increased immediate release of dopamine and norepinephrine in the moment, but this process helps to train your brain to know what it's like to be operating healthily. There is a higher probability of strengthening synaptic connections wherever dopamine and norepinephrine are increased. And when said connections are strengthened, they are more easily activated the next time. The conditions are met
for the synapses involved to strengthen so that those networks could function more efficiently later on, even after cessation of the drug.
Basically, the brain networks responsible for focus learn to focus more effectively through the example set by the drugs. This way, the drugs are meant to provide lasting effects. Because who wants to lose the benefits the moment they stop taking the medication?
How long you need to be on medication, the dose of the medication, that all depends on what else you are willing to do as a patient.
Yes, there are voluntary behavioral factors that help to reduce symptoms that might be used alongside the medication in a given treatment protocol. Healthy eating, exercise, but specifically in regards to ADHD, psychotherapy, which, when used to treat ADHD, is quite specific as it
develop an organizational system that will protect you from your ADHD.
We can use therapy as a means of learning, psychologically, what healthy functioning is. It can help us unlearn unhealthy habits and build strategies to organize and direct our life, developing structures and systems to account for our ADHD.
Essentially putting up guardrails so that your ADHD does not negatively impact your life.
A useful analogy, Dr. K. One study showed that starting with CBT, or cognitive behavioral therapy, in combination with meds was more effective than just meds at improving ADHD symptoms. This advantage lasted for 3 months, but at the 6 and 9 month markers, there was no significant difference. To me, this suggests that the combination may be effective in helping guide the patient through the process of adjusting to new patterns of activity, both in their brain and in their lives, as opposed to just getting their prescription and being sent on their way. At the 6 and 9 month markers, you could seemingly be sorted and just in a steady state of functioning. According to Dr. K, large population and longitudinal studies found that.
So first thing that evidence-based data suggests is that medication and psychotherapy are equally effective, roughly.
An important thing to note is that the difference is in duration of effectiveness after stopping treatment.
If I stop the ADHD medication, I'm more likely to go back to square one.
Though it's not right away that their symptoms return, they often do return at some point. Whereas with psychotherapy, the patient usually develops enough understanding of the inner working of their own brain and healthy strategies to cope that they then carry with them after cessation of the meds for either a longer period of time or even indefinitely. As Dr. K reminds us.
So the duration of psychotherapy far outweighs the duration of medication, which is an important consideration.
Ultimately, the goal of treatment is to learn how to live healthily, to get our brains to understand how to do this on their own, without meds or counseling. Creating a routine, organize your stuff in predictable places to avoid losing items, manage distractions, limit noise and overstimulation, have a clean workspace, reduce choices and options to avoid becoming overwhelmed between outfits, foods, movies, etc. Be clear and specific when you talk. Ask for clear and specific and brief directions. Plan, break down complicated tasks into smaller, shorter steps. Start early, take breaks. Chart goals and reward for a job well done. Discipline with compassion, not shame. Encourage the things you enjoy. Find a constructive outlet, creative, sports, academics. There are things someone with ADHD can do to help themselves live with the disorder in a way that doesn't negatively affect their life and to mitigate its effects. Many strategies are suggested for parents of children with ADHD, but as an adult, you can also apply these strategies to your own life.
And if you can learn how to organize, if you can learn how to prioritize, if you learn all these things, chances are you don't need medication.
Might I suggest placing a healthy lifestyle up near the top of the list? Eat well, get lots of physical activity and adequate rest. These simple behavioral factors have a massive impact on our overall health and well-being. And not just for those who get distracted easily. These days, it seems like general inattention has become the norm. Or at the very least, more of us seem to think we need help focusing. Between the internet and social media, it's as if we live in the age of distraction. It's hard to say the usage of these tools is excessive because they're such a regular part of our daily lives. We literally are plugged in. And it seems logical that social media and internet usage is a huge factor in this distraction epidemic. This is a relatively new problem and long-term effects are still being studied. But it would be no surprise to find that social media affects our attention span. These platforms reinforce instant gratification, affecting our ability to concentrate on anything. The short-form content on platforms like TikTok has us hooked in a loop of mindless and quick consumption with arguably less depth. Social media is designed to maximize engagement and accumulate views. So the algorithms are both feeding you things that you think you'll like and at the same time giving you endless options to make sure you stay on the platform, just in case you get bored. The bar is always being raised for content that can keep the public's attention. This is an issue when focus is needed for things that aren't as enjoyable. School, work, and easy scrolling through something like Instagram or TikTok. Sounds like something else.
Long-term users of Adderall developed an inability to feel pleasure without a chemical stimulant.
And when school isn't as appealing as online content, procrastination becomes a habit and academic performance suffers. Though the internet and social media can be used for amazing things such as learning, sharing, and communication, a lot of our use on social media platforms consists of shallow surfing, wherein we are bombarded with endless stimulation until we tire ourselves out, which we then typically remedy with just more scrolling, continuing on and on down the rabbit hole. Assistant professor of philosophy at the University of Virginia, Zachary Irving states, "Our minds used to wander during idle times, like riding a bus or walking. Digital distractions are instead designed to leave us stuck on a salient topic. What might have resulted in creative thought before is instead replaced by things like moral outrage or doom scrolling. Algorithms accomplish this by fostering a kind of sticky attention that Professor Irving links to anxiety and other mental health disorders." He continues by saying, "Right now, companies have your brain on drugs, versions of social media. And nobody wants that when the drug just gives you an anxiety disorder. That's a bad drug." Our brains have evolved to spend time in creative thought to counteract the possibility of getting stuck in the sort of loop that Irving describes. For this reason, we don't want our default mode network, the neural network responsible for daydreaming, to be completely suppressed.
After all, the default mode network is involved not just in self-referencing and kind of daydreaming, but also creativity and imagination.
Since creativity and imagination are, well, cornerstones of the human experience, there's a lot on the line here. Spontaneity expands our perspective, and it's important to have a healthy balance of both it and intentional focus in our lives. However, social media obsession hijacks both processes and throws the whole system out of whack. When a person gets addicted to using devices that increase distractibility simply because of the sheer rate at which the stimulus is presented and elicits strong emotional reactions which lead them to become even more invested in the material, we then continue using the device that is flooded with the stimuli that increases distractibility, and the cycle continues. Is my head the only one spinning? The symptoms or habitual patterns that are developing from this cycle and are being carried over into the rest of our lives may represent themselves like ADHD, which leads to more people thinking that they have it, and you can see why, with more young people growing up affected by this. These symptoms are becoming more and more common. This is crucial to keep in mind since ADHD is diagnosed by signs and symptoms. I wonder, in how many cases we're dealing with ADHD?
No, you suck.
Or a side effect of our obsession with social media and how our modern world works in general. Understand that attention span can be trained, like any other cognitive function. One can learn to concentrate and focus through practice. Concentration, or lack thereof, then is also affected by continuous exposure to stimuli and distraction. There is also a correlation between stress and attention switching. Multitaskers had increased blood pressure and also blatantly said that their stress levels were higher. This is because of switch cost, which refers to the reorientation time it takes to adjust to a new task. The internet makes it so easy for us to switch our attention that many of us are even multitasking on a device while multitasking, doing something else offline. We must be careful with children's internet use. It comes as no surprise that kids as young as 2 to 4 average 2.5 hours of screen time, while those 5 to 8 average 3 hours a day, most of which is on YouTube and TV.
Parents never train attention in their kids. Anytime the kid is upset, anytime the kid is distracted, take the iPad.
This is especially important because children are more susceptible to distraction, and it is harder for them to readjust once this has happened. When children are young, their brains haven't fully matured. The executive functions that govern the mind, involved in self-control, decision-making, and setting priorities, are still developing. If they're hooked on the screens, full of distractions, before they've developed this sufficiently, we may be priming our kids' minds to just be distracted. So, have we been setting our children up for success or not? The school systems providing formal education that have been set up since the Industrial Revolution share similarities in their structure and operation as the factories that were built alongside them.
First of all, if you were working in a factory, you became bound by time in a way that human beings had never been bound by time.
At the beginning, schools were a place to send kids while parents were working, and as such relied on strict discipline and demanded obedience. These long hours require children to sit still, be quiet, and read from textbooks that use very formal language and cover things that often seem boring to them. at least in the way that they were being taught. And as Dr. H reminds us, both children and adults with ADHD,
they have a very hard time getting into a forced state of focus for things that they don't enjoy doing.
There was increased pressure as a society because time was of the essence. The thing is, children naturally have lots of energy, are creative, and like to play. So putting them in such a rigid environment may cause some, especially more extroverted and enthusiastic kids, to appear hyperactive and disruptive, or creative kids to appear inattentive to information being presented in a bland way. However, they only appear this way in relation to the environment they are forced into. But was that environment built with the health and well-being of its occupants in mind?
So you're telling me your baby won't sit still in a way that's convenient for his teacher?
Yes.
The demands placed on the children by the school system contradict their nature as children. For many of them, their natural learning style didn't fit with what the school was offering.
And on page 2 of 3 in the How to Be a Teacher manual, it says that any child who's being difficult should be medicated.
For example, in a conversation with Joe Rogan, one of his guests, Eddie Huang, was discussing his experience with ADHD meds. He initially was told to take them after scoring extremely high on an exam, but not finishing it within the given time period. The solution?
If they're saying you have problems with time and attention, they want you to be a more studious worker. They want you to focus more. And so they're going to give you some fucking speed.
Should we take drugs to fit into the system, even if that system doesn't have the child's best interests in mind? Alternatively, couldn't teachers adapt their approach?
Instead of embracing their mental gifts, their first reaction is to shoot them up with hardcore drugs until they're mindless sheeple.
One study shows that college kids with ADHD have lower GPAs, report more academic problems, and are less likely to graduate, but did not differ in IQ levels. So they are just as smart, but are still having issues. This leads me to believe that the setting or the teaching style may need adjusting. ADHD isn't necessarily an inability to focus, period. But
it is immense challenges in focusing on lots of different things as required for normal life progression.
In Finland, they have longer class periods, less switching, much longer breaks between classes, and an overall shorter school day. The system isn't there to ram and cram information into their students, but to create an environment of holistic learning. Overall, modern school systems are definitely more accommodating to a child's needs. Research and test scores show that some cultures that balance the school day with less hours and more free time after school instead of homework and have a more relaxed atmosphere are arguably more effective. For example, Big Think writer Mike Colagrassi published an article on the World Economic Forum that discusses Finland's school system. He states that Western societies focus on this model of exhaustive brain draining as something Americans should aspire to become. More work, study harder, live less. Finland's system is set up such that kids can actually focus. If we have a school setting that isn't bringing out the best in the child, we have to take that into consideration before just saying they have a disorder. If we are limiting their natural tendency to be active and creative, then of course they will have issues. School is definitely more considerate of this nowadays. Teachers are more adaptive in their strategies and inclusive to student learning styles. But it's important to keep in mind the climate of society and its institutions at the time when ADHD was first recognized. Even if the school system has changed slightly, and I say slightly, to accommodate children's nature better, we now contend with other factors such as computers, social media, and with what seems like a desire to account for everyone's differences with a medical diagnosis. We must also consider our value system. Since the Industrial Revolution, with the factories and factory-like schools, we've gotten accustomed to just working more and more, instead of working with more purpose, valuing quantity over quality. It's almost like we, as individuals, are just a part of the system driven by profit. And with capitalism came the increased pressure to achieve. With social media, where it's easy to compare yourself with others, this is emphasized.
We are living in a hyper-competitive society where people are plugged in 24/7.
Or what about us struggling to keep up with the demands of the modern workforce? Should we take drugs in order to meet the deadline, fill the quota, or appease a board of directors that cares more about profits than our well-being? Or in this economic climate, some of us may need a boost just to make ends meet. Eddie Huang mentions that during a particular demanding time on a film set,
I was popping ads when we flipped to the overnights the first 3 to 5 days. I was much more of a soldier. Buy the book, do this.
And I can imagine about a million other scenarios where a little more get her done might help someone meet the expectations placed upon them, no matter how overblown those expectations may be.
There is a culture of you do stay up 16 hours for 7 days straight.
Realistically, what are the alternatives? If we, for example, demand less of people in stressful jobs, you might end up paying a little bit more for the fuel in your car, be required to grow, maybe even hunt some of your own food, wait a little longer for an important surgery, or for legal documents to be processed. You might be a little more vulnerable to ne'er-do-wells when those tasked with protecting us from harm are on a much-needed vacation. I mean, when I brainstorm ways that we as a society might take the pressure off, the implications are truly overwhelming. It would mean a total overhaul. Our society, our values, even our dreams and desires are infused with a sense of immediacy and a level of expectation that implies other people will be required to work overtime to meet our wants and needs. In other words, if you dream of being catered to, someone has to do the catering. Someone needs to build the dream house, build the dream car, and they better meet the delivery date. Hell, I doubt most people would be willing to wait a little longer than normal in the drive-thru for their morning coffee.
Are you fast like Jimmy John fast?
It's plain to see that our society is built upon systems that place impossible demands upon the average worker, the average person. And in such a society, it seems to me that ADHD or something like it is pretty much inevitable. Feels a little bit like jamming some 9 billion square pegs into a world full of round holes. And when we have difficulty meeting these demands, we make and take drugs to treat the so-called problem of inattention.
We can confidently say that there are more drugs to treat ADHD than any other psychiatric condition.
I'm not sure this is the best solution. Having described why a lot of people resonate with ADHD symptoms today, regardless of whether they have a diagnosis or not, and given the climate of our society, this can help explain why ADHD medications are becoming misused as a performance enhancement drug, both for intellectual and physical performance, rather than treatment.
I take it to push my performance further. I take it to push my body further. Normal, it wants to be normal.
For those using ADHD medication in this way, substance abuse is a major concern. Some take the drug for the first time and suddenly
they experience a lot of euphoria. Even if the dosages are low, the euphoria is associated with very heightened degree of focus that they've never really felt.
Allowing them to, as our friend Sam just mentioned moments ago, push further, get things done. For many people, this boost is enough to keep them coming back.
Our country is in the grips of an addiction crisis, and the abuse of prescription pills has contributed greatly to this deadly epidemic.
One such prescription pill, the ADHD stimulant known as Adderall, is being widely used as a study drug, giving students the edge in a high-pressure academic environment.
I mean, are people doing lines of Adderall in the library?
Yes.
Yeah.
Yes, I've seen it multiple times.
Just as originally intended. In fact, a study conducted by researchers at Johns Hopkins University found
of all Adderall non-medical use from ages 12 and up, 60% of it was among 18 to 25-year-olds.
This metric suggests that university campuses are full of people using stimulants to study.
The majority of the people that I know are taking it everywhere.
Personally, in my social circle, it's literally everyone.
I'm sure this varies between individuals, social circles, etc. But some estimates suggest that some 30% of university students use or will use Adderall to enhance their productivity.
And then when I got here and I was like, holy shit, everybody takes Adderall, everyone.
But I mean, who knows? 30% could be even lowballing it. Now, we've already established that this type of medication is associated with serious risk factors. Weight loss, anxiety, headaches, nausea, seizure disorders, cardiac events, and sometimes even psychosis. But what happens when these people enter the workforce? Will someone who's become accustomed to Adderall-fueled productivity be able to leave the medication behind?
It's becoming a regular habit. People are relying on it to write papers and do their reading and their homework.
And were they to stop taking the medication and their productivity decreased, what might happen? I imagine someone without an ADHD diagnosis who has become reliant on Adderall might present with ADHD-like symptoms. It's not as though this stuff is difficult to procure.
7 out of 10 college students say it's easy to get the drug from their friends or family.
Either, doctor, I can't focus at all, or, hey bro, can I steal a couple pills? According to a survey of 334 ADHD diagnosed college students taking prescription stimulants, 25% misused their own prescription medications to get high. Or what about the person hawking their prescription for extra cash in the dorm? And it's not just hearsay. The increase in Adderall usage can be marked by the prescriptions.
And we were trying to figure out how many people are on Adderall, and there was 41 million prescriptions, I think in 2020.
Well, Trilliant Health reported 41 million active Adderall prescriptions in patients aged 22 to 44 in the US in 2021, up 15.1% from the previous year. Remember, more people are taking the drug than there are prescriptions, and this is a large chunk of the population. Does it surprise you that we recently had an Adderall shortage?
And there's such a huge mismatch between supply and demand. What often happens is other things will go in to kind of fill that vacuum.
Social media, anyone? Or other stimulants? Maybe Concerta, Vyvanse, or a vape? And the cycle keeps a-cycling. More diagnoses and symptoms on the rise, along with the pressure to succeed or generally just keep your life together. No wonder Adderall manufacturers are having trouble keeping up.
That sort of influx in demand can have some issues, especially in a healthcare system that's already stretched thin.
From within that healthcare system, I can tell you that the system is at its limit. There is not enough time or money to address the demands of all the problems with which physicians are faced. Additional problems that can be traced back to the overuse or illicit use of stimulants places additional stress on a system that has no more reserve left to it. So you can see the potential for disaster. Just as the rise of demand seemed to creep up on the healthcare system, an addiction to this type of medication can, well,
it does really creep up on you. I mean, a doctor or psychiatrist may say this is an addictive medication, but you go into it thinking, I'm not going to be the one that gets addicted to it.
If a drug hijacks the reward pathway in your brain to produce more of the feel-good hormone dopamine, while simultaneously boosting focus by way of norepinephrine, it likely has addictive potential. In the case of ADHD medication, withdrawal can include anything from tiredness, sadness, and depression, hunger, irritability, anxiety, and the reemergence of ADHD-like symptoms. These withdrawal symptoms can be challenging to manage and may contribute to continued use of the medication to avoid or alleviate them. But I understand why people are taking it and why they might run the risk of becoming addicted. It seems to be a recurring theme. But society isn't doing us any favors. People are stressed with the pressure to achieve, and this trend is especially evident in our youth.
If you don't take it, you don't feel like you can keep up.
Keep up with what? This is another question that invites a veritable landslide of sobering thoughts. Keep up with your peers, keep up with your parents, keep up with the cost of living, or the Jones, and on and on and on. Who the hell sets these freaking standards anyway? And why does it seem like our only option is to go with the flow? I, for one, have been working 12-hour days with very little time off for about as long as I can remember. And I know I'm not the only one. Oftentimes, those around me tell me that I should take some time to relax. But to be honest, I just don't know how to do that. I have been grinding for so long that relaxing feels foreign and unnatural to me. Is it the ADHD? Or simply habit? I don't know. But it seems that even I need to take a moment or two to reevaluate and focus on myself rather than the myriad of stimulating things around me. If you enjoyed the video, be sure to subscribe and give it a big thumbs up to feed the algorithm. And if you are already subscribed, make sure that YouTube didn't unsubscribe you from the channel. If you didn't like the video, be sure to let me know why in the comment section down below. I read as many comments as I can, and we use your feedback to make our videos better for you. And don't forget to follow my gym, Human 2.0 Fitness, for free right here on YouTube, where we post content that helps you move better and prevent injury. Otherwise, as always, that's been a word from Dr. Chris, not your everyday ortho, where we see one, do one,